All right, welcome back, welcome back. All right, so we're going to get into our conversation with Dr. B.Yisrael, obviously here as well to celebrate the victory of East Side Steel Orchestra. And you would have known that they had won the small band national competition. And yeah, we're all celebrating. All right, and also we will speak about the increase in, well, we're hearing about cases of COVID-19. All right, let's welcome Dr. B.Yisrael. Good morning and welcome.
Gentlemen, Happy New Year, and yes, I am
you ready
excited.
Celebrate.
Yes. You should have seen me in Skinner Park.
Yes. Look, and the beauty, Wally, well, you know me, I'm a dramatist. So I love the intro and the local parlance, the actual Tobago twang. And this is, and our Trinidad brothers love to hear it, eh? And the execution, obviously, arrangement, fantastic.
Yes.
And you as a Belgian.
Yes, Belgian.
Belgian. Just tell me about how you felt being there. And of course, the victory was deserving.
It was absolutely deserving. This is my home band. If you know where I live, you know I live in the Panyard.
Exactly.
As a matter of fact, there are some times when they need to practice. I remember getting a call at 11:55 one night, and the call was, Miss Faith, we want to bring out the pants. You can move your car, please, and your girl just get up, put on your story, go down the road, move the car, and line with them for about an hour. So I am really, really happy they executed a masterful arrangement. The song I had honestly never even heard before.
Really?
We got to this point, I had never heard it before. But after hearing them practicing and going and looking for it and hearing the story behind it, it was a perfect song for the occasion, and I am so thankful that they were able to execute, and we...
Coach Ramsey, quickly, your thoughts on his genius. Yeah.
Kirsch, I think Kirsch is just an example of what Tobago can offer. And it's the entire group of them. The entire group that I would dare say have been trained by Tobago-owned Duvon Stewart, because these are all part of their programs in UTT and so forth that have gotten these arrangers to the point where they are doing things with pan that we never even thought could be done with pan musically. So I am just happy that we as Tobagonians have the opportunity to raise individuals who are such professionals in their own right, to have them start so young as well, and to be able to rise to national prominence. That is the Tobago story. That is what we are used to. Whatever we put our hands to, we does do good. You know, and I am just so happy that Eastside was able, and we boast that we were the first to allow him to arrange for us solely. We didn't want nobody else. Let Kirsch come and do it. This was a couple years ago, and he has been with us since, and I am very, very happy. By the way, I showed up, quick story. I was supposed to get the goat to Skinner Park. The goat ended up in Port of Spain.
Oh, shucks.
Yes, that is why we end up with a dog on the stage instead of the goat.
And the goat
was used in the semi-finals.
The goat was used because we're in country, you could just pull a goat from anybody right around kind of story.
So the goat get away? Or?
The goat get away. But it was probably a good thing because we saw all of the others, OJ with the uptown fascinators come with a goat in pot and all kind of stories. You know, so it was really when I got there, they looked at me, they say, wait, Faith, come, I want you to say this. And I was like, okay, this is the line I wanted to say.
So it was your voice?
It was me.
Yes. And again, congratulations, and it's good. I know, I'm thinking in football, if you probably score own goal or you got a red card, you're hoping that the team still comes out on top. And
you have to do what you have to do.
Still came out on top regardless of the goat going the other way. I probably should have taken, what band Maxi that would have been? I can't remember. I can't remember the color. But nevertheless, just before we come out of the pan, Maurice, the late Maurice, that you're talking about opportunities and stuff, he would have played an instrumental role, and I guess the players know of his significant role. Let's speak briefly on the late Maurice.
Certainly. So Maurice is actually was my godfather.
Okay.
And he died a couple years ago, and he was the one of the elders in the band for a couple years, and it was really him saying to the team, well, because we had oh my goodness, I've forgotten his name, who used to arrange for us, who died a couple years ago. And then when he died, we then said, okay, and Maurice and they decided, yeah, let's use Kush as our arranger, and that is why we are here at this point. So kudos to him. He will always be remembered. The entire Muir family. Well, you know, this is a Bell Garden bred kind of band, and they have evolved. And I am so, well, let me say though, I am so happy when you listen to and when you look at the young people who are now coming up, who are taking the reins. There was an interview on another media house where the PRO, I think he's the PRO, is a young man who is there, Mahabal, who does an amazing job representing the band and speak. He was the one on stage who got up on stage and took the trophy first. You know, and it shows that we are getting back to the point where the young people are coming back into the band, and that is what is helping to build the band, and we are national champions. I am just so happy about that.
All right, okay.
Yes.
Well, let's get into
so let's just shift now into something that is concerning. We're hearing of increased cases with the COVID-19. It's still here plaguing society, Dr. B.Yisrael.
Well, you know, if you remember me speaking about COVID when COVID started, I am the one who identified that COVID didn't start in 2019 or 2020. COVID was around, just different strains of it, different variants of it, and what became COVID, SARS-CoV-2, SARS-CoV-2, which is the virus that causes COVID-19, that was just a new variation of what was around. So it is going to be around. What we are experiencing now is really a combination of things. And what we're talking about is another word that we want to introduce, is the co-circulation. Co meaning together, circulation meaning moving around, of COVID-19, of the flu, and of other respiratory pathogens that are going around. So I am sure if you've heard people talk over the last couple of weeks, you would hear people say, man, that cold mashed me up, or that flu mashed me up, boy, I pray don't get at it.
What is it?
That is it. So it's a combination of different things, of different virus or bacteria that is circulating in addition to the COVID that is circulating. And this is not just in Trinidad and Tobago, this is worldwide. Because we are in flu season, and we just happen to have this additional thing that is moving around. That, you know, it's a cyclical thing. These things pop up every now and then and they go back down, and we just happen to be experiencing that right now. Because we are experiencing it, it means that we are seeing increased rates, and this is worldwide and to some degree in Trinidad and Tobago, increased rates of hospitalization, because people are getting so sick that they can't take care of it. You know, normally we drink with fever grass and the garlic tea and whatever else. We are seeing people who are saying, nah, boy, water more than flour. Let me go to the hospital. And we are picking that up. And we have a few who have made it even into the ICU. Not many, but have made it into the ICU.
There is a call to take the vaccine for influenza in relation to these new cases that are popping up. What relation is there, and is it that the influenza vaccine will combat this new?
So, by the way, I know that when we went through COVID, there were conspiracy theorists out there who was talking as if that was the first time a vaccine had ever been introduced to the world. No. There have been flu vaccines offered in Trinidad and Tobago and offered in the world forever and ever. So, and there are flu vaccines that have been available and are available now in Trinidad and Tobago. This is not new, which is why it was kind of disappointing that people were stressing so much on the COVID vaccine as if vaccines were new things. The vaccine that came around during COVID happened specifically for that, but the technologies were not new technologies. We have vaccines. So yes, we are encouraging people. There are flu vaccines that are available. You could get the flu vaccines. Right now in Tobago, we do not have any of the COVID-19 vaccines that are available outside of Trinidad and Tobago. So that is not an opportunity for us right now. But what we are asking people to do is to really go back to the things that we were talking about during COVID, the things that were not necessarily vaccine related. What were they? Washing your hands, soap and water. So we need to get back to putting the sink outside, ensuring that there's soap outside, ensuring that there's water running in the sink. Having sanitizer if you don't have that. If you are in a high-risk group, and what does that mean? It means that you're elderly. You already have another disease. So you have diabetes or some kind of cancer or something, some other kind of comorbidity. You are more likely to get more sick if you come into contact with COVID, flu, any of those. So you should also be wearing a mask if you are in that category. If you are working in an area where you come into contact with a lot of people, and a lot of people who you don't know, outsiders kind of thing, which means if you are in a hotel or if you're working in a restaurant, if you are in the hospital setting where, all kind of thing running around in the hospital, sick people are there, we are encouraging you to wear your mask. If you're going to be in a place where it's going to be a lot of you in a close quarters, wear your mask, because those are the things that are going to help to prevent the continued spread of these things that are circulating. Again, if you recognize that you do not feel well and you can stay home, you could isolate yourself from other people, do that so that you are not spreading it to other people. Depending on your situation, you may have to go to work. Make sure that if you know you have a runny nose, you're feeling kind of sicky, your throat kind of scratching you a little bit, you wear your mask in work. So we are really, really encouraging you to go back to those things that we know worked. And by the way, if you recognize, when we were doing those things for COVID, we had less cases of flu and cold and so forth. That's just by the way. Right. It is because those are the things that prevent the spread of the cold and the flu and those things.
Well, Dr. B.Yisrael, I'm thinking about someone who experiencing some symptoms, flu-like symptoms, and they go to the hospital or the health center. In terms of what is being detected, so when you go and get tested, are you specifically, do we have the equipment to specifically detect the variant? Because I know it's a combination that you mentioned, but to just detect the variant strains or what, whether it's flu as opposed to COVID-19 and so on? Right,
so this is what we do, and I actually had, we've been meeting with the health professionals to make sure that we have our protocols and that we are actually following the protocols. And there are protocols that says, if somebody comes in with this kind of thing, this is what you take the sample for, this is what you test for. If we do not have the machine in Tobago, we send it to Trinidad Public Health Lab in Trinidad. If we need to send it further to CAFA, also we send it out to there. So the hospital and health centers, the health professionals, they are fully aware of what samples you take, given the circumstance that presents itself in front of you, and then what to do with it after that. We also have a pretty robust surveillance mechanism. So after the health center or hospital picks up that this person has this symptom and they may have this illness, that information is then passed on to the surveillance unit, which is part of the Office of the County Medical Officer of Health, part of the Division of Health, Wellness and Social Protection. And that is where they're able to look every week. Let's see how many cases of this we pick up, how many cases of that. Let's see if it's going up, if it's coming down, and we get these maps that we actually see. Remember when we were in COVID, they started showing us these graphs and so forth. We're still doing it. We're just not publicizing it, and we're not giving it to the public to look at it, but we are looking at it internally to see what is going on.
The individuals are still encouraged to quarantine. Is there any mandatory stipulations?
No, we don't have any mandates as it relates to quarantining anymore. The same way we don't have any mandates as it relates to wearing the mask anymore. But what we are doing is telling people, remember, a government mandates these things when we've gotten to the point where it is the last choice. Okay. It is the only choice to protect us. So the fact that we don't have a mandate now, we are giving people the opportunity to take personal responsibility as an individual, personal responsibility for your family. If you're in a private sector, so if you have a restaurant or a hotel or whatever, and you realize you have a whole group of people coming from some other country to stay in your hotel, you ensure that your staff, mask up, and your staff wash their hands and use the proper practices, instead of, because we don't want it to get to the point where a government has to mandate it. But right now, there is no mandate. We are just really, really encouraging you to do it.
Very good. I take a sigh of that one, because in the event there is another, and you say, too, because God knows we don't need that. But however, Dr. Faith, the reality is, given what you just explained, that these strains, change and would come at you at any time. In the event there is another outbreak of any of the strains, whichever label they would carry, how ready are we to treat with this?
Well, the thing about COVID is that it tested the system. And the fact that we are here to speak about COVID means that the system worked. It may not have been the best. There are things that improved and we still need to improve, but the systems are in place and they have worked. And so that's why I said, when I spoke to the health professionals, it was really just a matter of ensuring that we were not lapsing too much, ensuring that we went back to the protocols that we had in place, that we developed for COVID, and determine how far left or how far we really need to go with those protocols, and implement them, or ensure that we keep implementing them. And that is what we have been. So I am convinced that we are going to be ready if anything pops up, because we learned the hard lessons from COVID, and we know what worked, what didn't work, and we could go from there.
All right, okay, so, and I am confident in the system, given what we had experienced, and we did reasonably well. All right, so we have to be on the lookout. Of course, Carnival is here, and we know after Carnival we just label a flu. It's either, when the popular tune now,
whatever it is,
we would label it that way. However, sometimes it's far more, and in some cases, some of these viruses are undetected. You don't show symptoms. When, let's say, you're not feeling well in regards to flu-like symptoms that may not have symptoms, because I don't want to say a hearing, but I kind of cautiously step in there. You would guide me as to where that is. In the event that Carnival over and there's something that we are faced with, given the visitors would come in and they would bring whatever, that area is where we cannot really manage. Given, remember, we were planning to shut down Carnival and have a right in that circumstance. What do we do, and how ready are we in that event?
And that is exactly why I am here now in January having this conversation, so that when we go into February, when we go into Carnival, as in, when we say Carnival, we're not just talking about Carnival Monday and Tuesday, but the entire season, that we go into it with these things in mind, so that when we come out of Carnival, we don't have to worry about what you are talking about. So it's really a precautionary kind of measure that we are encouraging people to take to prevent us from having to deal with that kind of circumstance after Carnival. Because remember, after Carnival is Easter, and then after Easter, so we have a full year of activities that we want to be safe for. Let me say, though, that one of the things we have picked up right now is that, particularly since children have gone back into schools, we are seeing rates of a kind of illness, a kind of pneumonia in children. And we are actually really, really trying to encourage parents. I know we know school just starts, you don't want to keep them home, but if your child really, really is sick, and have the runny nose and all of that, keep them away, because that is going to introduce the virus or the bacteria to the whole school, and we don't necessarily want to do that. So we are encouraging, because we are seeing a couple children who got so sick that they had to actually go into the hospital and had to stay in the hospital. So again, this is an opportunity for us to take front before front take way. This is an opportunity for us to go back to the washing of the hands with soap and water, for us to go back to wearing the mask, for us to go back to separating ourselves, for us to go back to ensuring that if we are ill and we do need medical care, this is the other thing. Because most people tend to be able to self-medicate and to stay home and to take whatever it is, we actually don't know the exact number of people who have the flu, who have COVID, who have any of these things on the island, because people are not coming to the hospitals or to the health center for us to record it. But because we don't know exactly, what we are encouraging people to do is to take those precautions. But if you recognize that you are feeling sick and you're not well, and it seemed like water more than flour for you, definitely seek medical attention. Either call your private doctor if you want to, or to the health centers or to the hospitals, because we don't want a situation where you wait, you're getting sick, you're getting sick, you're getting sick. You wait until you get too sick, and then by the time you get to the hospital, it's too kind of far gone. So if you really feel like you can't manage home, definitely call a health professional to get into the system so that we can help you.
Influenza shots are readily available?
Yes, we've always had flu shots readily available in Tobago. They are available now in the health centers, the Scarborough, Bacalet Health Center and so forth. They are available, and they've always been available, even before 2020 when the COVID vaccine came on.
Okay. All right. Anything else on COVID? I want to just shift to other issues in health. Anything else you want to just touch on?
No, just remind people to go back to clean out the sink that dirty outside of your building. Scrub it down. Make sure the water on. Clorox it down. Make sure that the water back on. Put back the soap so that people could wash their hands and get back to those practices.
All right. Cataract surgeries. There have been a number of compliments about that service. However, there are some people are having a challenge to access the service. What is happening now at the Roxborough Hospital?
Right, so I'm glad you asked that question. So the cataract program was a project that should have lasted one go around. You hear me? Remember last year when we did it?
Yes.
That should have been it.
Oh boy. However, the demand.
But the demand was so high, we decided that instead of cutting it off last year, we would do it again. Well, the year before, we would do it again coming to the end of last year. So we actually had 2 go-arounds. I don't know if you know, there are people who had cataract in both eyes. They did one eye a year ago. They did the second eye a couple months ago. So we wanted to ensure that we were able to capture that.
Right.
Now that project is over, you need to go back to, and you still have cataracts, because remember, we did it because there were people who were waiting since 2019 for their surgery, and because of COVID they couldn't get it. So it was really to clear the backlog of surgeries that were due. Now you should be able to go back to your regular eye clinic and be scheduled to do your surgery normally within the clinic setting. What we've done is ensure that we have the machines and the packs and so forth. So it will not happen as quickly, and you will not see the bulk of it happening. Okay. But people are still getting their surgeries done and so forth. It is available.
All right. So what do you need to do? Do you need to book yours?
So you go back to the normal clinic that if you were part of a clinic in the hospital, Scarborough or Roxborough, or if this is the very first time you realize your eyes kind of cloudy, somebody probably look at it and say, hey, you might have cataracts. Go to the health center, go to the walk-in at the health center, say, I'm not seeing properly. They can then do a referral to get you into the clinic, the eye clinics that are at the hospital, and then we could schedule it depending on what is picked up and what is actually diagnosed.
Well, good news. I just want to, as we in the carnival season, I saw from your social media pages, the division's social media pages, promoting in terms of tips excessive drinking and stuff. You know, sometimes we tend to get carried away. Not sometimes, most times. But just to emphasize, as we have the opportunity to speak with you this morning and on that, those tips.
Yeah, certainly. So we are going into the carnival. We are in the carnival season. You know, it starts on day one of the year kind of thing. And we want to just encourage people to not overdo it. Moderation is key. Moderation for all things is key. If you have to drink, ensure that you are not the one driving. If you have to drink, ensure that you do it in moderation. Know your limit. If you're no 2 Carib drunk in here, drink 1 Carib. There's no scene. Hold on to the bottle. Leave a little bit in the bottle and walk around with the bottle whole day, whole night. If you know, you have to know your limits. And so we are really encouraging people, because what most people don't recognize is that alcohol actually has a lot of sugar in it. So if you are diabetic, for example, and you drink the alcohol, you realize your blood sugar spiking because you didn't realize, even though it is not tasting sweet. So we're not even talking about the sweet tasting alcohol. We're talking about the regular old rum that you're skinning up your face when you take it. That actually has a lot of sugar in it as well. So you have to be careful that you don't have a situation where it's not just a drunkenness that we're talking about, but it also affects your long-term health after a while.
Dr. Faith, also, carnival and promiscuity goes together. There's no pretending. Sexual activities is very high. There used to be distribution of condoms and other safety, sexual protection.
Yeah.
Is your division on that drive this year? What is happening at that?
So I have not actually had a conversation about that just yet. And I would prefer, I don't ever use the word promiscuity.
All right. Okay.
Yes. There are people who are sexually active. My level of sexual activity may not be your level of sexual activity, but it is what it is. But we are encouraging people to continually be safe, no matter what kind of sexual activity you partake in. Ensure that who you have sex with want to have sex with you. We're talking consent there. So ensure that there is no, assault happening. Ensure that there is no rape happening. To ensure that none of that is happening. And when you are having consensual sex, ensure that you are safe, the person is safe, because you don't want a situation where after the 2 minutes, you now have a lifetime of responsibility that you did not prepare for.
But that's before you leave.
30 seconds, not even 2 minutes,
yes,
after the 30 seconds.
Before you leave, I remember last year you were clamoring for ambulance vehicles and that kind of stuff. Where are we with that? And of course, before you answer that too, I'll give you the opportunity, because I understand that one of the fatalities over the weekend is a member of the TRHA.
Yeah. So let me start with expressing condolences to her family from the Goodwood area. Condolences to her family. This was an unfortunate, and it's both of them who passed at the same time in that accident. Condolences from the Division of Health, Wellness and Social Protection and from the Tobago Regional Health Authority. But the situation with the ambulances. The last 2 years of being Secretary for Health, Wellness and Social Protection was plagued with a continual cry from the public. When we call the ambulances, they're telling me they have no ambulance to come for me, so let me come to the hospital on my own. When I started as Secretary in 2021, the first week or second week as being Secretary, one of the ambulances them get in an accident. About a month later, another ambulance got into an accident. These are ambulances that are like more than 10 years old, so they are declining anyway. So we have gotten to the point this year, late last year, where we were down to minuscule. There are days when you call the manager and doc, there's only 2 ambulances working right now, So we decided that we were going to have a fleet rented or leased. So you notice that you're seeing some strange looking ambulances that don't have TRHA written on them. They have, I think, Universal or something like that, some red and white ones. Those are ambulances that we actually leased from a private company to supplement what we have. And we have ambulances that we have purchased that are on their way here. I will not tell you when they're coming because it thing have a way when Faith said come in a particular day, they stand still waiting.
We are our Faith.
You know, so when they get here, all of Trinidad and Tobago will know that our new ambulances are here, and what we are doing is actually purchasing them in stages so that we don't have all going out at the same time.
All right, Doc, we gotta go. We gotta leave it there. We want to thank you for being here with us this morning, and of course, we look forward to celebrating with the rest of East Side.
Yes,
yeah? And of course,
and all of the other Tobago bands, the medium bands and large bands that are starting their prelims this week,
tonight,
we are celebrating with them as well. They'll be great.
All right, then. All right, we go for the break, and when we come back, lots more. See you then.